Thank you for watching this exclusive preview of the CME NCPD accredited activity exploring new treatment advances for acid sphingomyelinase deficiency in adults, presented by Dr. Neal Weinreb, Voluntary Associate Professor for Human Genetics at the University of Miami Miller School of Medicine. To bring this meeting to your institution and hear more about how new treatments are transforming patients' lives, please scan the QR code and request a meeting today.
Of our lecture goals was to deal with multidisciplinary assessment. What recommendations do we have for managing these patients, either if they're being followed or certainly when they're on treatment? And I think I'd like to point out that good management does usually involve incorporation of many different physician specialties, and it's very important to have a trained team of individual physicians and not necessarily always physicians as well, but other healthcare professionals who should be enlisted to participate in the care of these patients. And these, of course, include primary care physicians, sometimes metabolic disease specialists, neurologists, hematologists and hepatologists, pulmonologists. Again, the role of genetic counselors is extremely important as a hereditary disease. Other family members may certainly be involved, and either though if they are not involved, the likelihood that they may be carriers in the family who could potentially transmit the disease to later generations is also something that should be reviewed with both patients and with the families. Lipidologists, cardiologists also may certainly be required at various times in managing these patients. Additional disciplines, psychiatrists are oftentimes very important, or psychologists, speech and language therapists, occupational and physical therapists, nutritionists, social workers, as you saw before. Caregivers oftentimes have many issues which can require support as well as for the patients, and also developmental and behavioral pediatricians, particularly for the AB patients who are primarily children.